Do we need a meat geek?
I don't think so, because we're recording.
Okay.
Welcome, everyone. I hear that everyone is coming from that you all have been in an event together for most of the day. I hope that is going well. And you all are covering some good topics. We're thrilled to kind of be a part of that here today and share our Veteran Oral Health virtual road tour, talking about veteran oral health in Arizona with y'all. I'm Liz Flannery. I'm the Director of Education and Leadership here at the American Institute of Dental Public Health. And I see folks join. So I know that you've been in an event and have heard some seminars already today and some content. If you're able, I invite you to come on camera as you come on into the seminar here. This program is designed to be very interactive, so we have several times and ways that we want to hear from you and get your thoughts, and we would love it if you would join us on camera. I'm just going to do a quick tech check with you, Annalise. Are you able to see the waiting room if I kind of go ahead and dive in? All right, great, because I think some folks are still popping in as we go through here. So again, welcome everyone. We're thrilled to be here today. We are going to talk about veteran oral health. First, we're going to start with a national overview, and then we're going to dive in a little deeper and look at what veteran oral health looks like in your state. Again, we have several points throughout this presentation for discussion and for hearing from you. And we will talk about action items and next steps and what we can do with what we learned here today, as well as how you can move forward, get your CEUs, all of those fun admin pieces. Okay. Just a few housekeeping notes for everyone. We are recording this session. We will have the session, the slides available on our Academy, which is also where you will be able to get your CEUs after that. And we will provide links to that Academy where you can access that information at the end of this session. I know that you all have been together on another webinar in a virtual session today, but this time and space, in addition to being interactive, is also a time for you to connect with your local stakeholders. So I know you might have already known each other or had these discussions, but we invite everyone to post their name, their organization, email in the chat, so that if you're making connections, you can kind of follow up with those next steps pieces after our time here today. If you have any questions, again, please post them in the chat. I will pause and get to them, or Annalise will chime in and interrupt me, and we will get to those. Again, we want this to be very interactive, so please post those questions. We'll also have time where we can come off mute and have discussion. And if you need any Zoom support, you can put that in the chat as well, and our staff will help you. Okay. So if we go to the next slide, we are going to use Slido as part of our engagement here today. This is a tool that lets us gather answers to questions, answer polls, and kind of look at what everyone is thinking. So I invite you to go to slido.com and put in this reference number here, or you can scan the QR code here and pull up Slido. You can do that on your phone, and we're going to use that throughout the presentation. So I invite you to pull it up and keep it up as we go along. And Annalise, if you don't mind popping the link in the chat too, that would be great. Okay. We'll give everyone a quick second to pull that up, and then we can, as we're doing that, I will talk about our learning objectives. These are in our registration information and attached to our CEUs here today. Again, we're going to look at the state-specific veteran oral health in your state. We're going to evaluate some policies and how we can advocate. And again, we're looking towards collaboration with our local stakeholders, which all of you are here today. If we go to the next slide, we will have our very first poll of our session. So as we get started, we want to hear from all of you. Get warmed up with Slido and make sure we can use that technology. So if you haven't already, toggle back over to Slido. We want to hear what brought you to today's session. Was it learning, sharing, connecting, acting, or maybe all four of those? And we can, I think we are able to go over and see our results. Yeah, that's great. Thank you. Okay, all of the above. Learning is 75%. That's fantastic. That is always our goal with our educational programming here at AIDPH. But I see a lot of all of the above as well. And we'll certainly get to all of those pieces. I also see that all of you are very activated and doing a great job of participating with our polls and able to access Slido. So that's wonderful. Okay. We can go back to our slides, and I'm just noting that I am our presenter today and I do not have any disclosures to share. If we go to our next slide here, our host, oops, I'm sorry, Annalise, I'm giving you, sorry. Again, I'm presenting. I have Annalise here, who is our co-founder and executive director. She'll certainly be able to chime in on our veteran oral health work. It is something that she is deeply involved with from the beginning. And we want to give a very big thank you to Autumn for organizing this here today, ensuring that you all could be with us, sharing out the information and activating for Arizona. I know we also had some tech difficulties with our Zoom this week, so we want to give an extra thank you to Autumn and to all of you for your patience and grace with those tech issues. I'm glad everyone was still able to be here. We can head on to the next slide. Okay, so we're going to get started with another poll here, back to Slido. And we want to know, before we dive into the details and the data, what do you believe are the top priority areas for veteran oral health in your state? So this is good insight for us and will also allow us to tailor our content as we go through here and talk about your state-specific information. So we have access to care, oral health literacy, workforce development, policy advocacy, medical dental integration. Okay, access to care. I think that this has been our number one piece that we've been seeing across the board with these seminars. Integration. We're going to talk a lot about that in an integrated care environment and some specifics of why it's so particularly important for this population. Specifically, obviously important across the board, but particularly for this population. Okay. Great, thank you. Okay, we can head back to our slides and we'll get started here. So we can go to our next slide and we'll just give a quick overview of who we are as AIDPH and why we're here giving this seminar today. So we are a 501c3 nonprofit, and our mission is to empower our community to advance oral health through science, education, and advocacy. When we talk about our community, we mean you, all of you, our public health workforce, giving programming so that our dental public health workforce is empowered to go out and advance oral health. You'll see in this presentation here today that we have a fair amount of research on veteran oral health and how we're taking that information so our community can be activated. We're integrating that into an educational programming here today. So you kind of see the combination of all of those pieces in the work that we're doing here today. We're doing this work because we have a vision of a justice-oriented oral health system. We can go ahead and go to the next slide and see that we have 4 communities of focus here at AIDPH, which includes veterans, people in rural communities, LGBTQIA+ folks, and people with disabilities. And if we go to the next slide, we understand, of course, that there is intersectionality on these 4 communities of focus. We know that approximately 30% of veterans report having a disability. Approximately 25% of veterans live in a rural area, something that we'll talk more about today as we dive into the data. And of course, all of these communities have the common experience of historical exclusion and marginalization from healthcare systems. If we go to the next slide, we want to take a quick minute and say thank you to our funder, which is CareQuest Institute. I'm going to talk here about kind of our work in veteran oral health research and how that's been supported with CareQuest and been done in partnership with CareQuest all along. We began in 2021 really with a question from CareQuest saying, what do we know about veteran oral health? And unfortunately, the answer was very little. I think Annalise says the story goes that it filled maybe half of a page of paper, right? We really didn't know anything. And that began the process, right? And the first piece that we did was go to veteran service organizations and work with them so that we could conduct research in a community engaged manner. and really have the community lead the way. We began with surveys, went into public health data sets and analyses from there, and the body of research really grew. With that work, it has been tied closely with advocacy work, and we've had a few different Hill days, Senate testimonies, et cetera, along the way. And here we are today with our virtual road tour. And the reason that we're doing this work, something that we have continued to hear from folks is when we're talking about veteran rural health on the national level, we continue to get the question, what does it look like at my state? What are the specifics to my state? And so we really took that directive and had our research team work closely with our communications team to develop out the state profiles, which we're going to dive into a little bit more. And the reason I am calling out our communications team is because it was our research team that did the deep analysis, right? But we worked closely with our comms team so that we could build it into something that was very visually appealing and very easy for folks to use, which we'll see that again when we walk through your state profile. And that's because we always want our data to be usable. We want to put it into tools that our community can go out and use in the work that they're doing at the state and local levels. So last year we decided we really wanted to put our time into connecting with folks at the local level to ensure that they understood that these tools were here, and to also, again, foster a community discussion to give you a point of connection. So stakeholders that are engaged on veteran oral health, you can come together and connect on this seminar. And also so we have an opportunity to hear from you about what additional resources and tools you need to best support the work that you're doing so we can best develop those. We can go ahead and go to the next slide. And we're going to start again, I said, with a national overview. We can go ahead to the next slide and get started with that. So this might be familiar to some of you, but what we found doing this work is that for many people, sometimes even including veterans themselves, aren't fully aware of how VA medical and dental benefits actually work. So we're going to start there. So looking at understanding the eligibility process and what veterans can receive, or even where and how they can access that care, can be kind of confusing. That's why we like to start by setting a clear picture and setting the stage about what's currently available through the VA and what veteran oral health looks like at the national level. So here's the main key point of all of that, is that eligibility for medical and dental care through the VA isn't set by the VA itself. It's determined by Congress through Title 38 of the Federal Code. And that law outlines many things, but including what care is covered, who qualifies, and where it can be delivered. And because of that, any major change, like expanding dental coverage eligibility, requires congressional action. It's not just a policy or a rule update. It involves passing legislation and securing federal funding to support that legislation. So when we talk about the limitations in access to dental care for veterans through the VA, it all ties back to laws at the federal level. However, I also want to point out that that doesn't mean we can't take action and impact change at the local and state level. It takes getting educated like we're doing here today, collaboration with local stakeholders, and we're going to highlight some legislative success stories that some states have had a little later here in the presentation. If we go to the next slide, yep, we look a little more in detail to what this looks like and who is eligible. So again, main point here is that currently most veterans aren't eligible for dental care through the VA. So if you look at this graphic here, that row of people you see represents all 20 million veterans living in the US today. The lighter colored half shows the veterans who either receive care outside the VA or aren't eligible for VA healthcare at all. And as you move to the left of the chart, that darker blue section represents the nearly 10 million veterans enrolled in VA healthcare. Of those, only a very tiny fraction, that small blue and red segment that you see all the way to the left, is actually eligible for dental care through the VA. So what this can often mean in practice is that veterans might go to the VA for a medical appointment, get treatment for a chronic condition, but they can potentially still be leaving with untreated dental pain because they're not eligible for that care there. And one other point looking at these numbers, even among that, it's about 1.5 million veterans who are eligible for dental benefits, only about a third actually use them. And we need a little more data and insight into why that is, but some initial kind of findings and information we have, barriers to care and lack of awareness play a big role in that utilization rate. We can head to the next slide. We're going to look a little bit at chronic disease in veterans. So veterans living with chronic conditions like heart disease and diabetes are especially vulnerable to oral health issues, as I think probably many of you know here, the connection with those pieces. But what's even more concerning is that veterans with these high-risk, high-cost conditions are more likely to lose all of their permanent teeth. And we see poor oral health outcomes for veterans than non-veterans, even if they've seen a dentist in the past year. So access alone isn't solving the problem. Even when veterans are getting dental care, many still face some of the worst oral health outcomes. And a big reason for that is a lack of the integrated care, which I think that we saw that in the poll, right? That's a big concern for veteran oral health. And so really we can kind of see the complexity here and the connection between those pieces and why it's so critical to get some change moving. If we go to the next slide, we'll look a little more in detail. And this is from some recent research that we conducted, again, in partnership with CareQuest, that really focuses on the connection between chronic disease and oral health. So even after controlling for factors like income, education, and whether someone lives in a rural area, we found that veterans with diabetes are still 40% more likely to be edentulous, meaning that they have lost all of their natural teeth, compared to veterans without diabetes. Again, a really powerful indicator of just how strongly chronic disease can impact oral health outcomes. And we see similar pieces when we go to the next slide and look at heart disease. Veterans with heart disease were 30% more likely to be completely edentulous compared to veterans without heart disease. If we go to the next slide, we look at kind of what that means from a systems level, and highlighting here that this isn't just about poor oral health outcomes or reduced quality of life, although of course those are very serious concerns. It's also about the broader health impact and the cost of care. So when dental care is managed as part of an integrated healthcare system, like what the VA could offer if dental care was expanded, there's a clear opportunity for cost savings, especially for veterans with those chronic conditions. So some of our recent research shows that for every $1 invested in dental care as part of diabetes management, there's $1 savings in related medical costs. And with heart disease, it's even more striking. For every $1 spent on preventative oral health care can result in $2 saved in heart disease management. So at that point, dental care isn't just a health benefit, it's really paying for itself. And that's important context to keep in mind as we look at chronic disease trends in Arizona and consider what some solutions might look like there for you. Can head to the next slide. Just highlighting here where all this information is coming from. I think Annalise is going to pop in the chat. These resources are all available on vetdentaldata.org. What you're seeing is just a snapshot of the research and tools we've developed to help organizations like the ones that you are working in. Again, we want you to have clear, tangible data about veterans. And this information can be hard to find. And it's why we've worked with CareQuest to close and veteran partners to kind of pull in every available data point we could find from the VA, from national surveillance systems, and have a compendium of information all together here. Looking at those resources a little bit more on the next slide, we're about to kick things off here and share and look a little bit more about Arizona and give some background on this tour. So if you go to vetdentaldata.org, which I think we popped in the chat, and you hover over Arizona in the interactive map, you'll find a detailed profile. You can go to publications and pull up your profile, and we invite you to do that and follow along as we go through these details here today. So again, we're about to look at that profile and dive into those details. But before we do that, we want to pause. We will go to Slido again and hear from you about what you think your state's biggest challenges for veteran oral health before we look at those specific data. I see folks are in there. Funding. Okay, yeah. And Annalise too, I don't have my chat open, so if there's anything you want to interrupt me with, please do. Access. I think I said this earlier, but I think in every one that we have done, every seminar we have done so far, access has been our number one. Money, funding, health, population, access and knowledge of benefits. I know, again, kind of that understanding piece is really important. Mental, oral, impacting. Okay, great. Those are wonderful. We're going to head over to, I see funding and access coming up. So please feel free to keep plugging in. We're going to dive into the slides here, but that will remain open. So you can head to the next slide. Okay. Okay. So if we start at the top of the state profile, we open each profile with some quick context. Again, kind of the same thing we said at the beginning of this presentation, understanding kind of what's happening in Arizona and how it fits into the bigger national picture, especially when it comes to dental access through the VA. So again, highlighting that key point that we always include is that most veterans are not eligible for dental care through the VA. And sometimes internally we feel like a broken record, but again, we find over and over again, even just recently we're at NOHC, we had that as our trivia question at our booth. And just that it's always surprising to folks that the majority of veterans aren't eligible for dental care through the VA. So we start there. And again, that's an important place to start with policymakers, funders, decision makers, not realizing that. So when you're starting a conversation, it's a powerful place to begin. And okay, so then we've also included data on where veterans live across Arizona. I think we touched upon this with the intersectionality of veterans disproportionately living in rural areas. So we highlight here the counties that have the highest population of veterans. And up front, we hope that this gives you useful county level data insight, again, understanding where your veterans are, and you can intersect that with understanding where clinics are, where VA clinics are. Not every VA clinic has a dental clinic. So really kind of looking at that location information can be a really good level setting when you're looking at programming and how to address some of these challenges in your state. If you go to the next slide, we compare Arizona to national averages, because without that context, numbers really don't mean much, right? So if you're sharing this with a policymaker, a veteran, a program leader, they might not know if 17% is high or low or somewhere in between. So that's why we've included the national averages there. So to quickly kind of see where Arizona stands against those numbers. The other piece that we like to point out here is that you can compare not only to the national level, but there is a profile for every state in the country. So you can look at these Arizona numbers and compare them to other states, especially neighboring states or other states that might have a similar environment, can be really helpful. We'll look in a minute how to do that on a national map, kind of easy snapshot way. So earlier I mentioned that chronic disease, those high cost, high risk conditions like heart disease and diabetes that are closely connected to oral health. So we have those highlighted here. And in this section, you'll find data on heart disease, diabetes, insurance status, and dentism, again, all compared to those national figures. We also ranked each state across those 4 outcomes. So you'll see where Arizona falls compared to all 50 states. And just a heads up on kind of looking at those numbers, number 1 is the worst. So the higher, the better. Additionally, if you're interested in how we did those rankings and analyze the data, you can dive into those technical details. The methodology is posted on vetdentaldata.org under the data section. So if we go to the next slide, we really get to the grade portion of the profiles. And we took this approach, again, wanting to take our data and give it in a really usable way. Everyone understands what a report card is, right? And you can take that information and understand where you're doing well and where you need improvement. So that is why we kind of went with this from a usability perspective. We see that grades are individually given for diabetes, rates of uninsured, and dental visits. The percentage of veterans in Arizona that visited the dentist in the past year, and then those combined for an overall grade. And what I want to point out on this portion is to encourage you to not only look at the areas with a low grade or a low grade in your state. You can look at areas where you're doing a little bit better. You can look at states that are doing a little bit better and kind of dive into how did they get to that success story? What might they be doing? Do you have a colleague in the state that has a better grade? And take those success stories to address some of the areas that might need some more improvement. Okay. So we're going to pause and I invite you to pop in the chat, or if you want to come off mute and chime in. Again, the data is limited, and so we know that there are things that might not be represented here in the data. So we'd love to hear from you. Is there a barrier that you see in your state that you know is real but is not represented in the data that we have here? And it could also be something that maybe you think needs to be looked into more with the data. Okay, we'll keep giving you a minute to chime in with that piece. Oh, I see Jan said limited number of providers. I think I saw that earlier with workforce pop up as well, which we certainly hear over and over. Transportation. And if folks have thoughts on transportation in your area, something we always find is that transportation repeatedly comes up, but it is unique challenges based on the different states and the different geographical reasons. So if folks have any thoughts on transportation and what those specifics might be in Arizona, we'd love to hear that. Okay, I'm going to let you keep ruminating. Please feel free to chime in and we can head back to the slides and go into a little bit more about how we can use these profiles. I hope going through the details that we went on your profile was informative, but what we really want you to take away from the session here today is next steps and how you can leverage this tool in your work. So we can use the data to illustrate the need. We can share the profile to start conversations. We can take action and elevate success stories. So let's look a little bit more of what that can look like. Oh, and I'm seeing Colette put homelessness impacting veterans. It's hard to care about your teeth when there are deeper problems. Yes, absolutely. We see that over and over again, and with even things beyond homelessness. Okay. So one of the most powerful things we can do with this data is advocate. And that can look different depending on your role. Maybe you're a provider, a policymaker, or a veteran yourself. This profile gives you credible local data to bring to your city council, state legislators, or your congressional reps, or someone else. You could organize a listening session in your community and invite decision makers to hear veterans speak for themselves. We also want you to remember that small advocacy actions like calling an elected official, or even it might be an education session within your clinic, submitting a public comment. Those have ripple effects in really big ways. And so advocacy doesn't always mean being at the legislature and doing a full advocacy day, which it certainly can, but there are a lot of small, simple steps that we can take along the advocacy continuum that still make a big impact. We head to the next slide for educate to empower. Many people working in healthcare or veteran services don't know how stark the oral health gap is, and that's where education comes in. I think we saw this too. I think oral health literacy came up when folks were talking about some problems in your state. So we just want to point out that you can use this profile to lead a short talk. You could do it at your organization's staff meeting or to a coalition meeting. I think that's what we're hearing today, but maybe there's another organization, a partner organization. We really find that when stakeholders are informed, they become allies, and that's how we build momentum, sharing out the information. It's also an opportunity to collaborate across silos. So maybe you bring this to someone in housing, which we've seen in the chat here, or maybe you bring it to someone in mental health or food access and find a new way to align your efforts. So if we go to the next slide, looking at informing our strategic decisions, this data is a tool for strategic thinking. Whether you're leading a nonprofit, managing a health program, or advising on policy, you can use the profile to help decide where to focus. So again, it could be something like going back to that map piece and looking at where veterans are most heavily located, or something else. Maybe there's a rural county with no dental providers or a population group at higher risk. It also helps make the case for why you're investing resources where you are. And if you're doing an evaluation or reporting, it gives you a baseline. So here's where we get started, and here's where we're trying to shift. Can head to the next slide and talk about fueling grants and reports and grant applications, and talk a little bit about how you can bring in resources with this data. So grant makers and funders want to see data, and they want to see it grounded in the community. And this profile, we hope, gives you a start to that. You can use it in a problem statement for your grant or to show gaps in care. You can also cite it as a foundation for what your solution will address. And again, as a benchmark, if you're measuring outcomes and deliverables as a program, it can really be a starting point for you to show those measurable outcomes that you have set up in your programming. Okay, so all of that being said, we're going to pause and have a quick discussion. You can post this in the chat. You can come off mute and engage. But thinking through those 4 uses for the state profile: advocacy, educating stakeholders, decision-making, bringing in funding, what feels most relevant to your role and or your organization? And it can be as simple as you can just type one word into the chat. Advocacy. Seeing some double tapping on advocacy. Okay. Wow, lots of advocacy. That's fantastic. Education. Okay. I love that so many of you are working in the advocacy space and education, lots of overlap. That's fantastic. Okay. If we are gonna head back to Slido and hear from you in another way, if we go to the next slide, Annalise, we want to take a quick poll. And understanding, again, we want to know what resources would best support you, what additional resources. So we have listed here some options. And we want to be leveraging our tools and our research to best serve the work that you're doing. Again, hearing from you, education and advocacy is where you're really focusing. And we want to understand what additional tools would be most helpful to you in your work. Policy, which ties into the advocacy piece, educational materials, training modules. Okay. This is really fantastic. And if anyone wants to share research findings, If anyone wants to share more about the projects that they're specifically working on, that's not a specific question we have, but we invite you to share that in the chat. I know it can be helpful to share out with your local colleagues what you have going on and where you might have questions or need connection on. That was helpful. Thank you. We can head back to our slides. And we want to take a minute and do a quick highlight on, we've talked about several of the research projects that we've done and the tools that we have built out, and just taking a moment here to highlight some work that we've done on veteran oral health in Iowa. And this is really, we have had the privilege of working with Iowa very closely and doing, Annalise, can you hear me okay? Okay. Okay. So working very closely in Iowa over the course of several years, actually, and doing a very deep dive in research there, developing out and publishing a very comprehensive report, not only on what the state of veteran oral health looks like in Iowa, but with strategic recommendations. And I'm highlighting that because it's work that if your state is activated to look more into veteran oral health, it is work that we can advise on. We're happy to talk about kind of the approach there and how we did a deeper dive in Iowa. So the stakeholders there have some more in-depth action items to follow. We can go to the next slide. And I think, oh, I'm seeing you're seeing that the slide's not there. Okay. Annalise and I have worked together for a while now, so I could tell that she was unsure about something. We are missing part of our slide here, so I will just give you a quick recap of that. And that is that, again, this was a multi-year project we did in Iowa, where we did a year-long research analysis, then published a report that was about 75 pages long with the strategic recommendations you see here. We then were able to take that out and bring it to the stakeholders through a variety of ways, through virtual community forums. We then did an in-person summit, and hearing from folks what strategic recommendations were most doable based on their organizations and the kind of the environment in Iowa, we started working on a strategic plan that really laid out the technical assistance of how stakeholders can move forward on these strategic recommendations. So again, this is a deep dive that states can take, but I also want to highlight it because Iowa has done some really interesting things where they've been able to find some innovative funding pathways and ways to increase access for their veterans. And so if that's something that you're interested in, we really point to it for a lessons learned best practices model. Okay, we can head to the next slide. Okay. I'm just taking a quick look here. And before we go into discussion questions, I just pause and see if anyone has about the information that we've covered thus far. And you can come off mute and ask, or you can pop it in the chat if you have questions.
Liz, I have a question. Are you aware of any other states that have tackled veteran oral health policy and maybe the results of some of those policy maneuvers?
I am. Thank you for bringing that up, Annalise. So, and I might actually pass it back to you, but we like to highlight Oregon, Iowa, and Florida, who have three very different legislative successes that that have led to pathways to increased access for veteran oral health care in three very different ways. I think Florida is the one that is most recently activated. And I don't know if you want to kind of chime in on that a little bit more, Annalise, if I can pass it over to you.
Sure, I'm happy to. I am not in Florida, so this is what Florida stakeholders have shared with us. And we like to highlight this because we hear a lot about policy mechanisms within Medicaid, and that's just simply not possible for every state and every political landscape or environment. So there are other options. We highlighted one in Iowa, and I'll recount that in just a second, but let's start with Florida. Florida passed essentially a line item appropriations policy that gives a granting mechanism of about $1 million a year to nonprofit organizations. So that can be nonprofits who are giving care in the community. It could be FQHCs, it could be academic centers, any entity that has a nonprofit status to provide free direct care to veterans. So they will grant you essentially your cost of care to provide dental care for veterans who come into your clinic, and they can access that care at no charge to them. Which again is a cool model. When you think about it, $1 million is a lot of money to nonprofits for that care, but for a state budget, it's a relatively small line item. And Florida advocates were able to see some success in advancing that policy forward. We don't have any outcomes just yet because that policy was just implemented in April. So we're seeing how that evolves, but we're celebrating that success in Florida. The second one we want to highlight is Oregon. And Oregon passed this model, I want to say maybe in 2023, 2022, 2023. So it's been around a minute. And it is part of a Medicaid carve-out program is how we're understanding it. Step one with Oregon, which I really like and think is cool, is that they screen veterans for care coverage either through the VA or Medicaid. There are a lot of veterans who really don't understand their benefits and know if they have dental benefits. Part of that 2/3 of veterans who are eligible but don't utilize their benefit could certainly be rectified or remedied by just having access to whether or not they understand that benefit. And if they do, they send them to the VA. If not, they go through essentially a coordinated care network throughout the state where veterans can get free to them care coverage for dental needs. And lastly is Iowa. Liz has already highlighted that project page, but what we like about Iowa and what we think is pretty cool is that those funds are set aside through a grant program funded by lottery dollars. And Iowa veterans can apply directly to that fund to get out-of-pocket costs covered. So it's on the veteran. They do have to pay and get reimbursed, but it's a very successful program. And I think it's funded at about $10 million, which is really great. So those are some policy successes that states have been able to advance. And as far as we can tell, they've all three seen at least some level of success in utilization.
Thanks, Annalise. And I'm also curious, you know, so many people said that advocacy is really the area where their work falls. And I'm wondering if anyone here on the call has something they want to share about the advocacy work that they're doing or the direction that they're going in with that. Okay. Hearing none, we can kind of move to our next steps here, but I will say that, you know, if something occurs to you and you want to share it in the chat, please pop it in there and let us know. I'm going to go ahead and head to the next slide, Annalise. And again, this was a lot of information that we gave you. We got a lot of resources. We dove into the data, and I know that this is a small part of you all being together for most of the day today. And so it might take you some time to mull it over. But we want to make sure that we maintain momentum and that we're hoping that you're feeling activated after hearing all of this. So given that it can feel a little overwhelming, we want to leave you with just one small action item that you can take that's very doable, and that's inviting you before next month to share your state profile with one new person or organization. And if you want to pop that in the chat, so that you are being accountable to your local colleagues and sharing out who you're sharing with, we would love to hear that so we can support you on taking action on this. If we go to our next slide, we can talk a little bit about some housekeeping next steps. So as I mentioned, CEUs are available for today's session, and those will be hosted on the AIDPH Academy. Okay. So Colette, I take that to mean that you have shared out the profile with some new folks. So thank you. So our CEUs, Annalise is going to pop the link. Wonderful. Thank you, Colette. The link to our academy, which will bring you to the form to fill out to request CEUs for today's session. That will also be where we post the recording of this session. So if you're sharing out or you had colleagues who wanted to come but were unable to make it today, you can share the recording there, or you can go back and reference it. And the slides will be available on the Academy as well. Again, we shared it before, but you can find links to today's resources that we talked about on vetdentaldata.org. Again, there is an interactive data dashboard. There is a map where you can toggle over and very easily look at your information compared to other states in the country. And you can go to publications and hit Arizona and pull up the profile that we went over in the slides today. And finally, we want to invite you to participate virtually in Open's Hill Day, which is next week. We are headed with Open to Washington, D.C. Folks from across the country that are part of Open will be there for an in-person Hill Day. But if you have not already made plans to attend, there are opportunities to activate virtually and share information out about the asks that we are making about oral health access and equity while we're there. That includes veteran oral health. We're speaking specifically to that during this Hill Day. So we're going to share a link to Open. I think they might also have recordings to all the trainings they have done for those advocacy sessions, which are really wonderful resources, even if you're not participating in person. It gives a quick snapshot on kind of some main topics and some advocacy best practices as well, which I know, again, that was a piece that we heard here today that people are very activated on. So that is the end of our action items and our housekeeping. I think, Autumn, you have a link to go back to your main webinar. Is that correct? Are you able to pop that in the chat? I want to make sure everyone is able to toggle back. Oh, great, Jan. That's wonderful. Okay. So I'm just giving a minute here for Autumn to grab the link so you all are remaining together and heading back to some more virtual programming. And while we wait for that link in the chat, does anyone have any questions that we can answer or comments that they want to share? Okay, I'm gonna see. I might have the link that you all need in my email. I'm not seeing it in the chat. Thank you, Jan. So just give me 1 second and feel free to chime in while I do that. Perfect, Autumn. Thank you for posting. All right, it looks like you all have it. Okay, so we will give everyone a second to copy that and go where they need to go, but we want to leave you with veterans deserve equitable access to oral health care, and we thank you for being here with us today, participating in the conversation and being activated on this topic and helping to work on it in your state. So we look forward to seeing you in future programming and perhaps in DC. Have a great day, everyone.